H2 Health offers a wide range of services including physical therapy, occupational therapy, wellness and fitness programs, and more. H2 Health is here to get you back in the game with locations in Richmond and Berea. Visit h2health.com to learn more.
Madison County, like many other counties across the state, has actually seen a dip in vaccination rates from what was previously reported. According to Kelley McBride of the Madison County Health Department, this issue is not just confined to this area. It is due to double reporting.
As Governor Beshear had reported, some of Kentucky's vaccinations were actually reported twice. So what happened was the CDC informed Kentucky that the data from one pharmacy chain, and that happened to be Kroger, was reported to a federal database through two different sources. So they were reporting it to two legitimate sources and canceled each other out, so that it was only counted twice. But Kroger was doing their due diligence, reporting to the Kentucky Immunization Registry and directly to the CDC.
McBride said this was corrected immediately once the discrepancies were noted and reported to the state to change the numbers. In Madison County specifically, the numbers weren't as drastically different as seen in other areas of the Commonwealth.
The difference for Madison County was from just over 51% down to today's 46.1%. So it wasn't as large a difference as some counties may have experienced. I think it comes down to how many Kroger pharmacies are in your community and how many local folks that they provided the vaccines to.
As there is only one Kroger pharmacy in the area, this could be part of the reason why the numbers didn't take as much of a hit. McBride then goes on to explain why that 50% vaccination rate is so important.
Obviously, the higher percentage of folks that we have vaccinated is a greater percentage of people that are protected from serious effects of COVID-19. And we don't want people getting severely sick to where they have to be hospitalized or on a ventilator. We want them to stay out of the hospital.
McBride and the Health Department still stress the importance of getting vaccinated, especially now that the governor has recommended the third shot or booster shots. However, McBride says it's still too early to know exactly how these third shots will affect the fully vaccinated numbers.
Honestly, I don't know how they're going to count that. I do know that our nursing team here, they're making efforts to delineate between, a third dose and an initial dose. So those records need to be kept on each individual person so that they and their physicians know how many vaccines they have had, and if they do qualify as fully vaccinated. The booster dose is given to those whose immunity may be waning or decreasing because of factors such as age, other factors such as their living conditions or their working conditions. And because of the Delta variant, some of these boosters will be needed just to keep people protected from those severe complications and symptoms of the Delta variant.
Stay tuned, as WBON-TV will have more information regarding the difference between booster shots versus a third dose. For Channel 9 News, I'm Marissa Hempel.